Well, hello, everybody. My name is Dr. Schnorr. I'm one of the reproductive endocrinologists here at Coastal Fertility, and I'm very excited to be here with you. I don't know about you guys, but it's a very rainy day right here in Mount Pleasant, and it's going to make it easier so you don't have to drive around through the rain and have any of that going on. So there's some benefits to virtual conferences and telehealth, and you try to look for the positive in what's going on in the world. And I guess for COVID, maybe one of the positives is we get better with video and doing virtual seminars like we're doing today, and actually even spend some time with virtual telehealth. And so we've been doing a lot of that recently. So yeah, if anybody's kind of concerned about COVID and coming into the doctor's offices, we have solutions for that too. And we'll talk a little bit about that today. Just to give you some perspective as to who I am, I'm an OB/GYN trained physician who did a fellowship in reproductive endocrinology. I was fortunate enough to train at the University of Virginia and also spent some time in Norfolk, Virginia, where I did a fellowship at the Jones Institute, and I've been here since 2001, and really love what I do and love being here with you today. My job today is to talk a little bit about in vitro fertilization. As you know, that's one of the different treatments we have available for patients undergoing treatment for care. Dr. Slowey earlier talked about ovulation induction and intrauterine insemination, which is a great option, and we're going to talk about IVF. That doesn't mean that all we do is IVF. As a matter of fact, about 60% of all of our patients conceive with simpler forms of treatment like ovulation induction and intrauterine insemination. We'll talk a little bit about who IVF is good for and who it's not good for. Holly is with us today, and Shannon is with us, and they're here to help you. And in your screen on the right-hand side, there's a little chat menu. I would very much encourage you to ask questions. That's the fun part about giving a seminar, is that hopefully you do ask questions, and Holly's going to read those out. If it's appropriate for where I am in the talk, she's going to give me the question in the middle of the talk. If it's not kind of fitting into the talk, I'll cover them all at the end. I promise I'll answer all of your questions to the best of my abilities. So this is a picture of Coastal Fertility's baby party. We generally have one every year. Unfortunately, we didn't have one this year, as you might imagine. This is the 2018 that we had. And I really love the quote by Walt Disney that said, all of our dreams can come true if we have the courage to pursue them. A lot of you may think, well, Walt Disney, I mean, he's the billionaire, and so it's easy for him. But actually, he had bankruptcy several times before he had success with Disney World and Disneyland. And I think he's just trying to say in this is it takes courage to pursue your dreams, but if you pursue them, victory frequently comes. And we really believe that at Coastal Fertility, that with persistence, we are always successful. By no means are we successful every time we try, but with persistence, we can get to where we're going to be, even in the worst of situations where maybe there's no sperm or there's no eggs or there's no uterus, or maybe you don't have any of those things, we can still find a solution. And that's what we're here to talk about. So my job today is to help get you from this negative pregnancy test to hopefully seeking help, where we can teach you a little bit about what could be the causes, help you find the causes, and most importantly, get you to success. So that's what we're going to talk about today. Now, I'm fortunate enough to have three wonderful partners that I work with, Dr. Slowey, Dr. Cook, and then Dr. McLaughlin. And they are all wonderful physicians. We all work together as a team. I think there's a lot of value to having a team approach to care. We all have experience in different areas of our field. And when it comes to patient care, we come together and talk about patients and how we can make their care better. And having four minds thinking about it is better than just one at a time. And so that's one of the many advantages we have. Coastal Fertility has grown a lot over the years. We now have a total of 5 different offices. Our main office is in Mount Pleasant. That's where Embryology Lab is. That's where we can do x-rays and semen analyses and all kinds of different tests. We have a Lexington office, which is just outside of Columbia, where we can do new patient visits and semen analysis and ultrasounds and intrauterine inseminations and x-rays. We have a Savannah office, which allows us to do a lot of those same things, monitoring and new patient visits and intrauterine inseminations and sperm counts. We have a North Charleston office, which allows us to do monitoring and new patient visits and consults. And we have a Myrtle Beach office, which is wonderful, which also does those same things. We're working hard to grow into the areas where you are and you want us. And one of those, of course, is Somerville, a very rapidly growing area. There's this area there called Nexton. This is the new building we're building right now in Nexton. It should be complete in the month of December. And we are looking forward to welcoming you there and enjoying that wonderful new office. So we're very excited about that. In regards to why do we have so many offices? We have so many offices because we have a conviction and a belief that top-tier pregnancy rates come from a top-tier lab. And a top-tier lab is very expensive, very time-consuming to maintain and to manage and make sure that we have the quality assurance, the quality and controls we need. And so our conviction and belief is if we create one top-tier lab and then satellite offices all in your area, that you can get 95% of your care in your hometown, and then you would need to come to Mount Pleasant once for your egg retrieval, and then your embryo transfer can be done in Mount Pleasant or in our Lexington office. And so with that, we're able to maintain what we consider to be very wonderful pregnancy rates. I'm going to show you our pregnancy rates at the end, and I'm going to show you where you can find national pregnancy rates and other centers' pregnancy rates also. We do this high-tier lab through having an on-site laboratory director. His name is Dr. Jeff Gray. He's a PhD and a high complexity lab director. We're one of the few centers in the state that have an on-site high complexity lab director who runs the facility. And that's actually very good because he sees day in and day out what's going right, what's going wrong, and to gradually improve things over time. Yes, ma'am, we got a question.
Yes, this is from Tori. She wanted to know if the Charleston office is the only one where you can have an IVF performed.
Yeah, so the question was, is Charleston office the only office where you can have an IVF performed? The egg retrieval needs to be done at the embryology lab, and we have special incubators that we use at the embryology lab, but the embryo transfer can be done in Mount Pleasant or it can be done in our Lexington office. So those are the two places for transfer. So it's kind of a quasi answer. Yes, only one place for the retrieval. That's so you get the advantages of the lab, but your transfer could be done in one of two different places. We also have some really awesome, wonderful embryologists. This is Logan Roberts, McKenna Dyer, Alana White, who are wonderful embryologists who help us with the process, taking care of the eggs and embryos along the way. If you ever wonder where you can get qualified information regarding the pregnancy rates that a center has, is that we're all members of the Society for Assisted Reproductive Technology, and you go to www.sart.org to find our pregnancy rates, find national pregnancy rates, and other pregnancy rates for other centers in the area. And I encourage you to do that. In regards to our Centers for Excellence, this is Dr. Gray again, who just got awarded a nationwide award for his ability to cryopreserve eggs. This was awarded through Donor Egg Bank USA, which worked with about 50 different centers for egg freezing, and he won the national award for quality of egg freezing. That's just who we are. We do everything we can to double down on improving the quality of care you receive, your eggs receive, the sperm receives, and more importantly, your embryo receives. And along the way, we're at one of 16 centers in the nation certified for egg freezing through Donor Egg Bank USA, which is a very technically challenging thing to freeze eggs. And so having that certification is wonderful. Now, what do we think about when it comes to infertility? Where Dr. Slowey talked about this, we think a lot about the uterus and its structure and shape. We think a lot about the ovaries and the hormone levels that a woman has. These are all tests we do over about a month beforehand. And then we look at sperm counts. We think that the sperm count matters a lot, the shape of the sperm and the quality of sperm. So we always do testing up front so we know what we're dealing with, and then we move forward with treatment. And the treatment will depend on what we find along the way. If you have blocked tubes, in vitro fertilization becomes better. If your tubes are open, the sperm count's good, and the egg count's good, sometimes we can do simpler forms of treatment. So when I think about IVF, the first thing I think about is who needs it and who doesn't need IVF, and how do we figure that out? Well, this is a great graph that's produced by the Center for Disease Control, which looks at 2015 national statistics in the United States. And what this shows on the x-axis is the different diagnoses that a patient has, and the y-axis is the pregnancy rate with treatment for the average center. So this is not our pregnancy rates, it's the national pregnancy rates. I'll show you ours at the end. But what I see from this is if you have tubal factor infertility, your pregnancy rate in the national data is 27%. So that's kind of an easy thing to think of. Blocked tubes, we're going to bypass the tubes, pregnancy rate's 27%. Well, what if I don't ovulate? Well, actually, pregnancy rate's a little bit higher if you don't ovulate, 30%. What if I have endometriosis? Well, pregnancy rate's still very good with IVF with endometriosis, meaning IVF does fix endometriosis well. What about if I have male factor infertility? Well, actually, IVF seems to correct male factor infertility well also. And so we can see that IVF corrects a lot of things really well. Well, let's flip that coin upside down. What doesn't it fix well? What don't we want you to have? Well, what we don't want you to have is a problem with the number of eggs in your ovary. If you have low egg number or low egg quality, IVF doesn't make your eggs better. We don't know how to make eggs better. We want to, and we're working on that. But at the present time, we don't know how to do that. But what we do is work on making as many eggs as we can, and the number of eggs will compromise pregnancy rates to some extent. And that's part of your early testing, is that before you do IVF, we know how many eggs are there based upon ultrasound and blood work so that we can then move forward with care. Now, what is IVF about? Well, IVF is a 4-step process. The first step is to give you medicine to make eggs and then take the eggs out of the ovary. The second step is to now take the eggs and fertilize them in a test tube so that they become embryos. The third step is to grow the embryos in the incubator. And then the last step is to put the embryos back into the uterus. So that's that 4-step process that we go through when we do IVF. This is a picture of what an ovary looks like when it's on fertility medications. Each one of these black circles that you see here are where eggs are growing in your ovary. This is one ovary that has 10 different areas where an egg's growing in it. They're growing in pockets of fluid that we call follicles. We strongly believe that the number of pockets of fluid tells us how many eggs are there. The size of the pocket of fluid tells us the likelihood that it's mature and the likelihood that it's a good quality egg. And so during your IVF process, you would be on medications that you take injections once or twice a day. You'd have ultrasound measurements every other or every third day during the process for a total of 10 days, maybe 12 days. And then that process would culminate in an egg retrieval. Now, the egg retrieval is done in our Charleston office, as I mentioned. We have an operating room, which is adjacent to the embryology lab. You would be given IV medications that drift you off to sleep. You would be fully asleep, at which time an ultrasound probe is put into the vagina, and a needle then goes through the side of the ultrasound probe up into the ovary. And with low-grade suction, the needle is in the ovary. It pulls the fluid out. Egg's going to be on the side wall. Egg will come off the side wall, down the needle, and it'll be captured in a test tube. And that's where embryology team comes to play, is that we go through and we take out every egg that's in your ovary. We hand the fluid to the embryologist. Dr. Gray runs the embryology lab. He's our on-site lab director. He, of course, works with McKenna and Alana and Logan, who are then taking care of the eggs and the sperm and the resultant embryos. And that matters a lot. The embryology lab environment is critically important. Remember, the eggs coming out of Mother Nature, where you have precise body temperature and humidity levels and reduced oxygen levels and other things. We need to try to replicate that environment in the lab so that we can be as good as your ovaries and uterus are. Now, we do a lot of different things for that. This is what eggs look like. So we first survey the eggs under a microscope to make sure they look good, make sure that they're good quality. And then the second thing we do is we start preparing them for insemination. We personally use isolettes at our lab, and isolettes are basically the chambers you normally see babies in when babies are born. We've retrofitted that with a microscope in it, and it has certain oxygen levels and humidity levels and temperatures in it. So again, our goal is to maintain the body environment while we're working with the eggs and embryos. And to my knowledge, we're the only center that uses isolettes in the state of South Carolina to take good care of the eggs and embryo quality. I think we have a question.
Yes. Are all egg retrievals able to be done in your office, or would they need to be done at the local hospital?
Great. Question is can all egg retrievals be done in our office? And it's a good question. The answer is no. And the one thing we can't do is provide intubation, where we put a tube in so that you can be breathing by a machine. And that's something that needs to be done if your weight is a body mass index of greater than 40. And so if you have a higher body weight, there's an increased risk that we can't maintain your airway well enough and that you would need a ventilator for that. And so with a greater than a body mass index of 40, we would need you to have your retrieval done outside of the building. And so we encourage you to lose weight because that allows us to do IVF in the building, but also gives you a higher pregnancy rate and a lower miscarriage rate by losing weight. So it's a very good question. So we use these isolettes to take care of the eggs and sperm while an embryologist is working. Here's an embryologist working with an isolette right now, just so you see an example of how that's done. This is just one extra step of layer of precaution and safety that we provide for you so that you have better eggs and embryos at the end. The other thing that we do is we have the ability to do intracytoplasmic sperm injection, which is the way we can help fertilize eggs. You have a couple of different ways to fertilize the eggs. One way is if the sperm count is normal and the eggs look good, we just actually put the eggs and sperm together and we put them in the incubator. We have a rule that says what happens in the incubator stays in the incubator. So we put the egg and the sperm together. We let them have a little party in the incubator together, maybe add a little Bud Light, maybe a little background music, and then see if in the morning if we have embryos or not. And so that's called standard insemination. It's a very common way to fertilize. That works well, again, if the sperm count's normal and the eggs look good. It doesn't work well if you have malfactor infertility with a lower number of sperm or abnormally shaped sperm or sperm that aren't moving well. There's a relatively newer technique called ICSI, in which we can actually take one egg at a time, hold it in place with this little suction pipette that you see here. That's holding this egg in place. And we have a needle right here with a helpless little sperm right in the center on it. That little sperm's in a mission. It just doesn't know it yet. And so what we can do is we can actually put the needle into the center of the egg. We can deposit the sperm in the center of the egg and take the needle back out. And by doing that, get the same fertilization rate as if the sperm count was normal. This has revolutionized IVF in a way, in that it used to be you needed millions of sperm to have an embryo. Now you just need one sperm per egg. So if you only have 10 eggs, you only need 10 sperm. For example, a typical sperm count might have 60 or 70 million sperm. So 10 sperm is generally something available for everybody. That then results in embryos. This is what an embryo looks like on day 1 of embryo growth. Still a one-cell embryo. And over time, we can understand the quality of the embryo. So a lot of people might ask, well, what is an embryo lab for? Why do we have an embryology lab? Well, it helps us figure out which embryos are normal and which embryos are going to give you the best chance of pregnancy. If you have 5 embryos, a fair bet would be probably 1 out of the 5 is going to give you a baby. We don't want to put all 5 in your uterus because it could be 3 out of 5 would give you a baby in your situation. And needless to say, that would be a bad day. And so what we use is the lab to really play the role of surrogate uterus, so that the embryos can be put in the lab. The lab, being a high quality lab, takes care of them as well as does the uterus. The embryos then grow in the lab, and therefore we can pick the best embryos and put them into the uterus. We do that by growing them out in test tubes like you can see here, and using special next generation incubators. So this is what a typical incubator looks like. Every one of these are locations where embryos can grow inside the incubator. This is a 4th generation incubator that does a particularly good job, one of our newer incubators that we use. And so that allows the embryos to grow on day 2 from 1 cell to 2 cells and later to 4 cells on day number 2. And then on day number 3, they develop into 8-cell embryos. And most transfers are done at the blastocyst stage, which is day 5 of embryo growth. And this is a time when the embryos now have about 150 cells, and the cells are trying to differentiate themselves between the placental cells that you can see here in the inner cell mass. That's the part that's going to be the baby there. So it's neat to see that happen. We then typically take the embryos and either transfer them to the uterus or freeze them at this stage of embryo growth. Transfer is done while you're awake. You're both in the room together. Speculum's put in the vagina. Catheter goes right into the top of the uterus. Generally do 1 embryo transfers. We really feel strongly about the importance of 1 embryo transfers because we know that a multiple pregnancy has a 7 times higher risk of autism and a 7 times higher chance of cerebral palsy. So our job is to try to keep the multiple pregnancy rate low for you. So a lot of people want twins. They think they just kind of get it one and done and fill the family all at once. It's your risk and your baby's risk that we're trying to protect you from. Now, a lot of centers do multiple embryo transfers. Frankly, they often do them because their lab is not providing the pregnancy rates that you need. And so therefore they try to compensate by putting extra embryos in. That is able sometimes for them to boost the pregnancy rates, but they do it at the cost of multiple pregnancies and pregnancy complications from having multiple pregnancies. So the goal in our field and for our society is to minimize and even eliminate multiple pregnancies. With a 1 embryo transfer, you would have about a 1 to 2% chance of a twin pregnancy. And so it'd be very rare, it'd be nature's risk of a twin pregnancy with a 1 embryo transfer. Additional embryos can be frozen. Freezing embryos is a wonderful way for couples to have more than 1 child from an egg retrieval safely. And so what I always like to say to people is you can have as many children as you want, 1 at a time. We just don't want to have them all at the same time. This is a couple who did just that. This is an older photo, as you can see. This is a time when 2 embryo transfers are common. This is a couple that had 2 kids on their own, 2 kids in the fresh cycle. 2 kids in the frozen cycle. So they did fill the family with 1 egg retrieval. You got to get your own dog. We don't provide the pet. You can find your own pet, but we encourage you to have pets. Now, what's kind of new in our field? What are the things that we would talk about when you come in? Well, there is the ability to freeze embryos and transfer the embryos in what we call the frozen cycle, meaning we do your egg retrieval, we make beautiful embryos, we intentionally freeze the embryos, we rest your uterus for a month, and later put the embryo in 1 month later. Why would we do something crazy like that? Well, we know that the extra hormones created from an IVF cycle can over-thicken the uterus, and that over-thickening makes it so that the embryo won't grow as well into the uterus. Freezing protocols have become safer over time and more efficacious, and so we can now freeze the embryo with generally minimal harm and get you a big benefit by resting the uterus for 1 month, and so that's generally how we manage that, is we do a lot of what we call freeze-all cycles. The second thing that's a real important topic is the ability to do genetic testing of your embryo. Sometimes an embryo can look beautiful and be beautiful, but still be chromosomally abnormal. And if it's abnormal, it's going to give you a low chance of pregnancy or a high chance of miscarriage or a high chance of a birth defect. Some patients benefit from this. Not all patients benefit from it. It's our personal belief at our center that below 35 years of age with a normal family history and a normal genetic history, there's probably not a lot of benefit to genetic testing of your embryos. And for women 35 and above, because of age alone, there is an increased risk and you may benefit from having genetic testing done. That would be an individual counseling session. When you're here, we can talk about that. What are our pregnancy rates? I promised you that we would talk about pregnancy rates. And our pregnancy rates are the pregnancy rates reported to our national society who audits pregnancy rates. And so again, this is the website where you can go to see our pregnancy rates, and you can see the national pregnancy rates and other centers' pregnancy rates. I compared ourselves to the national average. We're not allowed to compare to our competitors. And so I compared to the national average. The red is the national average, and then blue is coastal fertility. And this is the live birth rate. So what matters to you is the likelihood of giving birth to a baby, not getting pregnant, but giving birth, compared to the number of patients we saw. So this is the live birth rate for a patient coming in to see us for the first time. And this shows us that the live birth rate is about 75% if you're under 35 years of age as a patient coming to Coastal Fertility to do an IVF cycle. Pregnancy rates do go down as female age goes up. That's expected. That's found in every study that's been done. And you can see here what our pregnancy rates are over time. These are pretty stable numbers. These are pretty stable from year to year and haven't changed a lot. And these are pregnancy rates I'm very proud of and very respectable pregnancy rates. Nobody's got 100% pregnancy rate unless they maybe did 1 cycle and got lucky. But anybody who does a reasonable number of IVF cycles is going to have some failures along the way. And frequently that's due to egg quality or embryo quality or other things that can be corrected over time. If you fail on 1 IVF cycle, it doesn't mean you're going to fail on all of them. What are the risks of IVF? If I tell you everything good, I should also tell you the bad, right? And so the bad is multiple pregnancies. We talked about the fact we almost always do 1 embryo transfers. 2 embryo transfers have an increased risk of twins and an increased risk of triplets. Ovarian hyperstimulation, where people get sick from making too many eggs. That's something we've been able to really limit now with some newer medications. It'd be very rare to have bad ovarian hyperstimulation. Used to be 1 in 500 or so got hospitalized. Probably right now it's 1 in 4,000, 5,000. And so a lot of wonderful new medicines that help us with that. So we think that ectopic pregnancies can also happen. An ectopic pregnancy is one where the pregnancy is growing inside the fallopian tube. It's very rare to have that in IVF, but it affects about 1 to 3% of IVF cycles. You might ask, how do you put an embryo in the uterus and it gets stuck in the fallopian tube, where the uterus can contract and push an embryo up into the fallopian tube, and an abnormal tube will retain it there and it won't come back out. Internal bleeding and infection from the egg retrieval does happen. It's about 1 in 500 cycles. And we, of course, can give antibiotics or whatever we need to kind of fix that problem if that were to happen. What about COVID? How are we managing COVID? Well, we are managing it. We don't think COVID should limit what we do for you. We don't think it's fair if couples can be trying to get pregnant on their own at home with regular intercourse because they have normal fertility, but you can't. So we are here seeing patients, and we're following the CDC guidelines for that. Along the lines, masks are worn by all staff and all patients at the present time. We're again going to follow the guidelines and follow the guidelines. No patient, to our knowledge, has contracted COVID from being cared for at Coastal Fertility, and we didn't stop at all. We've continued all the way through in a safe fashion. And I guarantee you that no staff member has contracted COVID from working at CFS. So again, we do social distancing and masks and all those things we need to do. I'm convinced that we can do this safely and get rid of COVID. Last I heard, maybe a vaccine was kind of around the corner, and I'm real hopeful for that for everybody involved. So with that, I'm going to stop. I thank you guys for being here. I hope that you're safe and dry. I know there are some questions, and we're now going to go through some of the questions. So if you have more, let us know. Give them to us right now while we're answering these.
Okay, so I've got, how much is it for IVF?
Yep.
If you're using a known donor split cycle where the donor is a family member?
Got it. So I think the question was, if you're doing IVF with egg donation, so you're using somebody else's egg, and we're not having to pay a donor, we're going to actually use a family member. And so a donor typically costs about $5,000. And so a normal egg donation cycle might be $20,000, and kind of estimating. So my bet is you could do that for about $15,000, and that would include medications. Now, the pregnancy rate would be relative to the donor's age. And so if your family member, for example, was 40 years of age, we would see a pregnancy rate of maybe 15 or 20%. If your family member was 25 years of age, we'd see a pregnancy rate probably closer to 60 to 70%. So that's a good question.
Okay, and then what is the average cost of IVF?
Regular IVF is probably about $12,000 for the IVF process itself, and that includes an embryo transfer. It does not include medications. Medications range depending on how much you need, but can be around $3,000 to $4,000 of medications.
Okay, and I have another one. What are the tests leading up to an HSG, or is this something that I can request to have?
So hysteroseptingogram is an x-ray to make sure that the tubes are open and working. It's a standard test that we do for all couples with infertility. And what you would do if you had infertility is you'd have blood work done to test your egg count, a semen analysis, an ultrasound, and generally an x-ray to make sure the tubes are open and working. Some people might wonder, if you're going to do IVF and you're going to bypass my tubes, why do you care if my tubes are blocked? But there can be a distal blockage of the tubes at the end that if we know you have that would lower pregnancy rates, and we can correct that before we do IVF. So IVF can be compromised sometimes by abnormal tubes.
Okay, one more. Are you still offering the bundle deal with a guarantee?
Yes. So we do have money back guarantee programs. These are basically insurance programs is what they really are. And if you were interested, you could pay a lump sum of money. And with that, you could be given 2 or 3 egg retrieval cycles, use of all the embryos that are created from that. And if you don't give birth to a live baby, you would get all of your money back. And so there are money back programs available, and that sometimes is real nice in a world where there's a lot of chaos going on. I think you'd want to know that if you're going to pay money, you're going to get something for sure out of that. And that's the way those money back guarantee programs were designed. So that's a very good question. So we would like to help you get to this, a beautiful, happy baby. We want to keep your baby warm, so we give you a nice little hat with a coastal emblem on it. And maybe we need to get a rain jacket with the weather we got going on. Maybe we need baby rain jackets. That'd be cute. So we'll have to talk about that. We're going to negotiate over that. But anyway, any more questions?
Yes, I got a couple more real quick. Okay. There's someone that if they're doing an IVF cycle in Savannah, will they be able to do an IVF cycle in Savannah at the office there, or will they have to come to South Carolina?
Yeah. Again, so we believe in what I call spokes on a wheel. We believe that to deliver top tier pregnancy rates to you, we put a high quality embryology lab in the center, and we reach out to you as the spokes on the wheel so that 95% of your visits can be performed down there. So for example, in Savannah can do everything for you except for the egg retrieval and embryo transfer. So a drive up for your egg retrieval and a drive up for your transfer. And so that's what gives top tier pregnancy rates. So give you a little personal story is that I have a daughter named Courtney. I have 2 daughters. They're amazing, Jessica and Courtney. And Courtney needed some jaw surgery, and we figured out it was going to be a fairly complicated surgery and couldn't find anybody in the local area we were comfortable with. We found somebody in Charlotte who was 2 hours away, and we made multiple trips to Charlotte to get it done the right way. And I'm proud to say that the surgery came out perfectly. She looks good. She's able to chew better. Everything's good. That was some of the best times we ever devoted to her. is to help her get care at the right center to give her a good outcome that we're all very proud of. And frankly, it was fun times. When we drove, we might find a little local restaurant or something where we enjoyed and made it a fun trip. And so while I'm sad that I can't create a lab for you in each of your hometowns, it just simply is not affordable to do that. And we are able to do it with a regional office system, so you only need to come once or twice to the Charleston area. So hopefully that answered that question.
How much is an IUI when paying in full?
Right. Well, an IUI is a cycle where we actually take the sperm, concentrate it, and put it into the uterus while you're ovulating. Generally, the IUI procedure itself is about $700. And then there's generally some medication which is used, which might be $300 or $400. And then you would need some ultrasounds and blood work along the way, which might be another $700. So that totaled around $1,700 to $1,800 for a typical medicated intrauterine insemination cycle. All right. Well, you guys are wonderful. I appreciate you being here. I hope you're safe and warm at home. If you have questions, feel free to call us. Phone number at our office is 843-883-5800. You can also go online to our website to request an appointment, and we can talk. We can do it by telehealth, or we can do it in person or by phone, whatever you guys want. We're pretty flexible. And that gives you time to understand what your cause of infertility are and what options are for treatment. It doesn't have to be IVF. We talked about fancy stuff today. The good news is we have fancy stuff. The better news is you most likely don't need it. And so we're here if you need us. Thanks for being with us. Take care. Bye-bye.